Hi Jenny, there's some exercises for you for your knee. So basically the first thing to think of is to try and make sure that when you're doing any squats and things like that, that your knees stay in line with the middle of your feet. So really what you're trying to do is not allow this sort of thing to happen as you bend down. And really what that is it's your muscles around your hips working to keep your legs stable, really. Because really what you've got to think is your knee being a hinge between your ankle and your hip. If either of those are unstable, it hasn't really got a chance. And a lot of the reason why people end up, and possibly why, I know you're sort of twisted, but after ACL injuries or in ACL injuries, is that when they land, the knees kind of end up coming across ways like that. So just starting off, just doing some simple squats and just getting used to it with your feet facing forward, and basically making sure your knees come down nice and straight. And basically what you're trying to work up to being able to do is do that on one leg. So you can kind of just go up and down on one leg. And what you're just trying to make sure doesn't happen is that your knee doesn't come across like that. Another good exercise you can do for it, just standing on one leg and trying to lift the opposite hip up and down. And you should feel, after doing a few of them, in here you start to feel it working. And this really is the muscle that's working to lift this side up, basically. And then other ways of doing it are like a single leg bridge. So just lying on the floor, and then what you're just doing is pushing your pelvis up into a bridge. And then what you want to try and do is just really concentrate on holding, using the muscles around your hip to keep your pelvis level. So what you don't want to happen is for this, as you go up, as you go onto one leg, and just holding that there in that position, you really feel it in your hamstring and in your buttock. And it's good to do it on both sides anyway. And again, just really try and make sure you keep the opposite hip up.